To observe International Women's Day today, on 8 March 2023, Department of Microbiology Raidighi College presents Gut Microbes and Women Health. It's time we recognize that each person has different circumstances and we should allocate the exact resources and opportunities needed to reach an equal outcome. It's high time that we should be working towards true inclusion and embrace equity.
Medical gaslighting refers to the unjustified practice of ignoring or dismissing a patient's symptoms, concerns, or experiences. And this is especially very common in case of female patients. Unfortunately, there is a reported discrepancy in the presentation of the genders in health studies and clinical trials. Women are underrepresented and their physical complaints are often trivialized or simply blamed upon their imagination. So, this Women's Day, we call upon the inclusion of gender as a dimension in clinical trials, and being microbiologists, we focus on the importance of gut microbiome and women health.
Many recent studies show that women are actually genetically hardwired to be tougher than men, thanks to having two X chromosomes. But being a woman may sometimes come with an increased risk of various illnesses like osteoarthritis, heart disease, anxiety, certain autoimmune diseases, urinary tract infections, genital tract disorders, fertility issues, menopause related complications, and, of course, a few specific forms of cancer.
The human microbiome refers to all bacteria, viruses, fungi, and archaea living on and within the human body, with the highest number being found in the gut. Babies acquire their mother's microbiome either through the birth canal or when they face the skin during a caesarean delivery. Many factors influence the indigenous microbial composition within each niche and among individuals. Recent advances in DNA sequencing technology and computational resources have made it possible to characterize them in great detail. This has opened the door to extensive studies on the causes of different disease and the maintenance of women's health in relation to the gut microbiome. Now, our students will elaborate on how a healthy gut can improve women's health with the help of a few examples.
The gut microbiome is a complex ecosystem of microbes acting upon and changing in response to the host environment. The gut microbiome is dominated by five bacterial phyla as shown in the slide. A healthy gut microbiota improves digestion, metabolism, and immune response. Gut microflora can affect the reproductive endocrine system by interacting with estrogen, androgen, insulin, etc. and changes in normal gut microbial population can lead to diseases.
Polycystic ovary syndrome is a serious endocrine disorder in females of reproductive age and also in postmenopausal women. It is associated with many clinical conditions including hypertension, lipid imbalance, insulin resistance, high levels of androgens, type 2 diabetes mellitus, acne, male like hair growth, etc. It is one of the primary causes of infertility in women and often leads to anxiety and depression. Recent works has shown a close relationship between changes in the gut microbiome and development of polycystic ovary. Improvement of gut microbiota with the help of probiotic, prebiotic, and symbiotic agents can help release symptoms and serve as new treatment options.
An imbalance in the gut microbial community is associated with cancer progression. A healthy gut can help lessen the risk of cancer development. Many recent research papers have examined the anti-cancer activity of the metabolites produced by the gut microbes, specifically against breast cancer. For example, butyrate is a short-chain fatty acid that has shown anti-cancer potential against multiple cancer types, including breast cancer. Similarly, niacin, a bacteriocin, has shown anti-cancer properties, primarily against gastrointestinal cancer and also against breast cancer. In addition, gut microbial metabolites improve the efficiency of standard chemotherapy drugs. Gut microbial species can also directly modulate breast cancer risk via alteration to host metabolism, estrogen hormone recycling, and immune pressure. Further investigation and clinical trials are needed to formally use this strategy in cancer treatments, as gut microbial metabolites could be more cost effective, have greater health benefits with lesser side effects, can be highly selective and more bioavailable than standard chemotherapy. Osteoarthritis is one of the most common musculoskeletal diseases characterized by degeneration of cartilage, inflammation and pain, morning stiffness, swelling, limited range of joint motion, and decreased quality of life. Women have a greater risk of developing knee, hip, and hand osteoarthritis compared to males, and effects tend to be more severe. A higher prevalence is observed in women at the time of menopause. Recent observations have led to hopes that probiotics would provide beneficial treatment strategy. Prebiotics also can be selectively utilized by host microorganisms, leading to stimulation of the growth of different beneficial bacteria in the gastrointestinal tract. For example, supplementation with oligofructose, which is a prebiotic fiber, can help increase the abundance of bifidobacterium, a species with anti-inflammatory properties, resulting in the reduction of systemic and knee joint inflammation, the preservation of cartilage, and an encouraging treatment option for arthritis, especially in women.
Gut dysbiosis is related to mental health. Ongoing research from many labs indicate that females experience higher perceived stress and depression can reshape the gut bacteria's composition through stress hormone, inflammation, unhealthy food choice, poor metabolic response, and autonomic alteration. In turn, the gut bacteria release metabolites, toxins, and neurohormones that can alter eating behavior and mood. Digestive disorders such as irritable bowel syndrome, gastritis, leaky gut commonly coincide with mood disorders. Stress is also associated with an increased risk of cardiovascular disease, metabolic syndrome, and mortality. Antibiotics can destabilize the gut microbiota and increase the risk for anxiety or depression. In contrast, probiotic supplementation may have positive effect on depression, anxiety, and stresses. So, the gut brain axis is crucial for both mental and physical health, especially in women who often have to face greater stress in society than their male counterpart.
Thus, a balanced microbial population can lead to a happy, healthy gut and influence physical and mental well being. This is true irrespective of any gender bias. Let us embrace equality and equity to ensure a happy, healthy life for all. Happy International Women's Day from Department of Microbiology, Raidighi College.